the latest in our UI Health Distinguished Scholar Series. So my name is Dr. Bob Barish, and I'm UIC's Vice Chancellor for Health Affairs. And so what's my role here at the university? I'll just describe a little bit. So I have responsibility for the university's academic health enterprise. And UI Health, what does that mean? My office oversees the clinical enterprise that includes the tertiary hospital, over 40 care locations, 11 Mile Square health centers, which are federally qualified. And by the way, you're here at Mile Square, the building we call Mile Square, although it's really Jerry's space on the third floor. So UI Health also includes the academic and research activities of UIC's 7 health sciences colleges. I think many of you know we surpassed the $500 million mark in research, or over $500 million now. And what are our colleges? And many of the deans are here. Applied Health Sciences, Dentistry, Medicine, Nursing, Pharmacy, Public Health, and the James Adams College of Social Work, with campuses throughout the state as well. So it's a pleasure to welcome everybody here today. So as the UIC's Vice Chancellor for Health Affairs, it's my goal to elevate the service and mission of robust healthcare academic health sciences enterprise and our healthcare delivery system. And this series of lectures has an important role in fulfilling this pursuit. So a little bit about the history. Several years ago, you know, Dr. Christian, Jerry's a very hard person to say no to, approached me with the idea of engaging healthcare thought leaders from across the nation in meaningful conversations so that we may share their expertise with our local community to better serve our patients. We wanted to get rid of traditional slide presentations, no PowerPoints here, and host more intimate conversations with notable experts that can inform our operations and healthcare delivery. So it's through this symposia and discussions such as this that we foster exchange of information, innovative ideas, and new knowledge. So the Office of Vice Chancellor for Health Affairs is pleased to present this collaboration among Population Health Sciences, the Chief Medical Officer, Chief Clinical Officer, Chief Nursing Officer, Chief Quality Officer, and Chief Diversity and Community Health Equity Officer. Hey, Ronnie. So it's intended, this series, to offer an opportunity for UI Health community to learn from and share information, ongoing research, and discoveries with national recognized healthcare leaders. So, having said that, without further delay, I would like to offer a very special welcome to our distinguished guest. I call him Dr. Ego, and I first met him when he walked across the stage in Washington when he was inducted this summer with, where's Terry Vandenhoek? With Terry at the National Academy of Medicine. Yeah. Ego, what an incredible honor that was, and it was great to meet you there. So Ego is the Grady Distinguished Professor of Medicine at Emory University School of Medicine and Professor of Behavioral, Social, and Health Education Sciences at Emory University Rollins School of Public Health. As a clinician scientist, Dr. Ego's career has been devoted to combating the long-term effects of HIV infection, particularly among underrepresented populations, while focused on the threat that age-related comorbidities pose to healthy aging in persons with HIV. I must say we had a wonderful dinner last night at Coco Pazzo, so I hope you enjoyed it, despite the weather. It was really wonderful. So you'll hear more about his extraordinary accomplishments and the important research he continues to pursue. But for now, I want to thank you, Ego, for taking the time out of your extraordinarily busy schedule to join us live and in person. And thank you for tolerating the weather here in Chicago last night. So today's conversation is an exceptional opportunity to engage with another acclaimed leader from a familiar national academic institution. I know we're all looking forward to learning more about the important work and experiences that you will be sharing with us today. And by the way, I told you I did your review as a national institution. I was one of the accrediting bodies that accredited Emory several years ago. Not like you needed it, but I was part of that.
Thank you for giving us the pass.
And I remember your famous statement is still undefeated in football since 1872. They've never had a football team, so that's what I learned. Okay. So now I would like to welcome our Associate Vice Chancellor for Population Health Sciences, Dr. Jerry Christian, for a brief introduction of our panel as we begin our discussion. Jerry, it's all yours.
Great. Thank you so much, Dr. Barish, and thanks to all of you for joining us today. We really have quite a quite a session that I think you'll be excited, you'll be stimulated. We're going to hope that you're thinking about the question you're going to ask as well. So all of this is to kind of catalyze thinking and working together. So I want to add a couple more comments about Dr. Ofotokun, and then we'll have our panelists introduce themselves. As Dr. Barish was indicating, Igor really has a very prominent role at Emory. He is also a world-class scientist. He's the administrative PI, so the overall PI of the MAX-WISE combined cohort study in HIV. And for those of you that know about human immunodeficiency virus and AIDS, that is sort of the gold standard that we have now used that to understand the pathogenesis of HIV and then subsequently informed the many clinical trials. And now HIV is a chronic disease. And for many of us that were in healthcare at the time HIV came out, that's not what it was. It was a fatal disease within days or weeks or months. So thank you, Igor, for that work. As they say now, Igor's work has now led him, and drawing on that experience, he now leads the Atlanta hub for the NIH Research COVID to Enhance Recovery or Recover program, which we at UI Health are also a hub. And so that's actually where I met Dr. Ofotokun. I realized when he was on calls with me that he was a special, very special person. He knew how to get to the bottom line about how we're going to make some progress, and we had to make difficult decisions, but he always did it in a way where everyone felt heard in the process. So he's a very gifted, I would say, communicator and a gifted leader. And I'm hoping that as we get into today's session, you'll see some of that. You'll get as inspired as I was when I first met him. He serves also as the national chair of the Recover Adult Cohort Coordinating Committee that oversees the governance of the adult cohort, roughly a $500 million sort of activity to understand long COVID. Dr. Ofotokun has contributed substantially to the expanded representation of women and minorities in biomedical research, leveraging his expertise to promote research education throughout the world. A lot of his work is in Nigeria, Ethiopia, Georgia, Vietnam, so he's global, as they say. As an advocate for equitable representation in biomedical research and workforce, he has briefed Congress, advised NIH leadership, the African Centers for Disease Control, and African governments on multiple occasions. So it really works at the policy level as well. He has over 240 peer-reviewed original articles, book chapters, and so on. His contributions really are enormous. And as Dr. Barish mentioned, he's also been recognized by the U.S., really the scientific community, as a member of the National Academy of Medicine in 2023. So we're really excited to have him here. But he's going to be working now. We're going to be asking him a bunch of hard questions. And, the purpose of this is really to understand how leaders think, what motivates them, how do they problem solve, so that we can learn about how to apply those skills in our daily work. So with that, I'm going to kick off my first question, and then Ronnie Williams will introduce herself and ask the next question, and then Dr. Lin will do the same, okay? So I'm going to start off with a, I don't know if this is a softball or a hard one. You're going to have to decide, Dr. Ofotokun.
From Jerry is soft.
These are hot mics. You got to be careful here, okay? So Igor, what would you say most people don't know about you? It could be something personal or professional you don't mind sharing.
What people don't know about me. I think simplicity. Yeah. People think I do a lot. Some of them are deceived. They think that I know a lot. But if you really want to know the core behind everything that I do, is really simplicity. I do everything within my power to make everything that I do so simple that everyone can see through it. I like plainness. And so if you ask me, I am wearing this, there's this small bang on my wrist, the word in it is simple. I like really simple. And I think that is what really defines a lot of who I am, although sometimes it doesn't come true because people see the volume of work and say, this guy has to be complex. But I'm very simple.
Thank you, Hugo.
Yeah.
So I'll then ask Ronnie Williams to introduce herself and ask her a question.
All right, thank you. So good afternoon, everyone. I'm Ronnie Morrison-Williams. I'm the Chief Diversity and Community Health Equity Officer at UI Health Hospital and Clinics. What inspires you in your daily work, besides simplicity, of course?
What inspires me in my daily work? That is a very loaded question, and I can spend the whole session talking about what inspires me. When I was a kid in grade school, this was in Africa, in Nigeria. I think I was in my maybe 8 or 9 years old. So we studied the history of West Africa. And so many of you will recall the history of West Africa was really history of great empires and stuff like that, but it was also history of slavery, history of Europeans coming to the continent. And then along with those slavery also came missionaries. And many of them started schools. Many of them started hospitals. Many of them began to eradicate diseases that were killing people, tackled malaria, waterborne illnesses, diarrhea illnesses, challenged a lot of the cultural norms that were detrimental to human health. So my young mind at that time reading the history, many of them were nurses, many of them were doctors, and I saw what they did. You know, in the midst of all this devastation of slavery, man inhumanity to man, and then there's this other group here where there was so much service to humanity, you know, and then my young mind just began to think about medicine and medicine as a force for good. And I was 8 years old, and it just got stuck with me that if there is a profession, healthcare, nurses, doctors, coming around and doing a lot of good. And I saw medicine as a force, as a tool for good, and that stuck with me. And I think that is really been my true north since then, you know, that going into a profession, it was not easy for me to go into medicine. There were very few medical. I think when I was taking my entrance exam, there were, 6 medical schools in the country that was able to accept, less than maybe 500 people. There were about 350,000 applications for the limited opportunity. But I saw this as an opportunity for good, and I just poured my heart into it. And I think that is really I see this as an opportunity for service to humanity, for service to good. And I think that has stuck with me throughout the years.
Absolutely. Thank you so much.
Yeah.
Janet, Dr. Lynn?
Yes, my name is Janet Lynn. I am the Chief Strategy Officer for the University of Illinois Hospital and Clinics. My question, I know actually Dr. Barish and Dr. Christian have already waxed about your accolades.
Yes.
But what have you strived to achieve that is most important to you?
I have been asked these questions on a few occasions. I've had opportunity to think about it. What I wanted to do in life, which I think I have accomplished, was to be a voice for those without voice. And through my research, and I can give you example upon example, that what we did gave voices to people who did not have voice. I will give you, I think during the last session I had, somebody was mentioning our work on HIV in women. And I remember when I started taking care of HIV patients in Atlanta, many of the black women wouldn't take their medications. And a lot of people were very frustrated. Why would they take their medication? It turned out there were only two major options of medication at that time. One of them was a drug called favirenz that actually that's teratogenic. And then the second one was atazanavir. So atazanavir turns people yellow. And so you have yellow eye, yellow fingers, and your body yellow. And with the stigma of HIV at that time, many of these women, you turn yellow, you go to church, people like, oh yeah, she must be HIV infected, she's turning yellow. And then we decided that we were going to change that paradigm and started looking for a new drug that would not do, that is safe for the baby, but will not expose people's HIV status. And so those kind of things, and that changed, after we did all of that study, that changed adherence among African-American women. So being able to use my platform, to be a voice for those without voice was probably one of the things that I'm proud of the most of all of my accomplishments. Whether here, our work here in the US, our work in Africa, or in Asia, or across the globe, we've given voice to people without voice, those at the margin of society.
Thank you so much, Dr. Ofotokun. It's, I'm trying to, in my mind, reconcile simplicity with all the other things that you're doing. I think we have a lot to learn, so thank you for those comments. So I'm going to ask the next question, and I'm giving everyone in the audience a little bit of time to think about your question here, because we're going to come to you pretty soon. I think it is said that change is the only constant. And I think we are now in an era where there is change happening all across the globe. And we are in an academic health center here at UI Health. So the question I wanted to ask you is, what do you think the major issues are that are facing leaders in academic positions related to health today?
So healthcare is becoming complex. Healthcare delivery is becoming really complex. People are living longer. Diseases are becoming even more complex. We have transplant, immunosuppression, and the complexity of care, it's much more than it used to be. And then we have a lot of advances. The technology, what we have to do in order to take care of people is no longer simple looking at your chest X-ray or taking your blood and going to the microscope and doing a plain film. So the complexity of healthcare, it's one challenge. And with that complexity comes the cost of healthcare. So being able to balance providing a complex care at an affordable and equitable manner, it's a huge challenge for many academic health centers. And then you layer that on top of the regulations. So there's complexity of the regulation of healthcare. So I think being able to take all of that complexity, simplify it in a way that you can prioritize, the things that are important for the particular patient in front of you, and being able to customize that care in a cost-effective way. It's one of the things that I think it's a big challenge that I think Dr. Barish would acknowledge is what we have to all think about. Yeah, we want to give the best, but we want to give the best in a way that is affordable. We want to give the best in a way that is equitable. I think that is the huge challenge. Yeah.
Can I add to that?
You want to do an audible?
I'm going to do an audible.
Okay,
Sorry.
now, everyone see, I wasn't the one doing the audible.
Sorry, Eileen.
I'm usually blamed for audibles, but okay, Dr. Lin,
No,
please.
because
Yeah.
absolutely true in terms of complexity of the patient care and the technology and the advancements in science that we have. But I also wanted to ask you, how does the complexity of the patient themselves and what they bring to the healthcare system, how do you think we should be addressing that, i.e. the social determinants of health, things that Ronnie deals with on a day-to-day basis from a system level, how would you recommend that we as leaders address those issues amongst the complexity of the medical care itself?
So the simple answer is we need to listen to our patient. We need to listen to our community. We need to be less prescriptive, and we need to be more of a consensus building. We need to engage in consensus building. What a community may need, what an individual patient may need, may be different from what you, the care providers, think they need. And I think we need to build in the need of the community, the voice of the community into our care model. And that would help us to prioritize things that are important to them. Yeah.
Thank you.
So Janet took my question. My question was really a building on some of the answers you gave, but you really just gave, some of that in terms of, you've talked about simplicity being kind of one of your founding principles, right? You talked about your motivation around getting people what they need. And so my question was going to be, what strategies do you use to create equity and inclusion? But I think you shared a little bit just now in the answer to Dr. Lynn's question. Is there anything else you'd want to add to that in terms of ways that we should think about strategizing around equity and inclusion?
So I can give you an example just to kind of bring this point home. And I mentioned this earlier in one of my discussions. When we were asked to come up with a follow-up to RECOVER. So as many of you are aware, the RECOVER, it's this study to understand long COVID. We've been working on it for the past 4 years. And UIC is a huge center. And first of all, I want to thank all of you for supporting RECOVER. The contribution of Jerry and the team here has been incredible to the entire enterprise. So when we were asked to design a follow-up to RECOVER, to the long COVID questions, you can fill a whole book with all the type of research that can be done on long COVID, because we don't know much about long COVID. And so NIH reached out and said, there was no notice of funding opportunity, no guidance. We want you to design what the next follow-up question for RECOVER is. And we pulled the team together, over 100 people, and we had 300 different directions that everybody wanted to go. And at the end of the day, what we did was ask people with lived experience, what are the 3 things that you really want to see addressed in long COVID? And that was what really drove the next stage of RECOVER. What the people who are living with the condition wanted us to address, not what I wanted to address, is let it be driven by the consumer of your product.
Absolutely. And I'll take a personal point of privilege and re-emphasize your point around, especially as we do work in the healthcare space and we continue to talk about equity, inclusion, getting patients what they need, we have to listen to those with lived experience in order to create solutions and interventions that work for them. Thank you.
Well, I can see already my questions, hopefully not a hard question for you to answer, because based on how, just your ethos. But how do you stay optimistic?
How do I stay optimistic?
Especially in this environment.
It's my belief in science, my belief in what science can do, and not only just my belief, what I have seen science can do. And I have told people about my journey with HIV. I was a medical student when the epidemic broke. When I was a resident, we had medication, but they were very, very toxic. I spent all my residency managing not just the disease, but the toxicity of the medication. By the time I finished and I started practice, it's 1 pill once a day. Now we have medication that we can give once every 3 months, some of them even once every 6 months. And people living with HIV, it's now a chronic illness. the disease is being controlled. And that is really the optimism that science gives. You know, there's so much potential in what we can do when we exercise our intellectual curiosity in the right direction. I have so much faith in academia and what academia has to offer. And that is really what gives me professional optimism, the potential of what is possible through the funding agency, the scientists, and the community. That it's what we have done and what we'll continue to do really is what drives my optimism. In spite of all of the ups and downs, I believe in the promise of science. Yeah.
Yeah, I mean, I think to just build on this, this is actually maybe one of the areas where academic health centers really need to be front and center in creating optimism, because that is what we do. We do the science, we deliver the care, we train the next generation, and I think we have to step forward here in having that optimism be part of how we carry out, even in the face of challenges, because we have seen this before. There are cycles to everything, and we will have another cycle, another opportunity. Yeah. So my question now, these next few questions we are going to ask are questions that were submitted by several of you who are seated here, who submitted some questions in advance. But in a few minutes, we're going to turn this over to all of you. So Carlos, I hope you're thinking about a question. I know you are. You're smiling at me. So there's a question coming from that's been asked. Okay. Yeah, he's our dean for the College of Applied Health Sciences. I'm sure you'll have another question. And I think so. This question comes from Emily Cowie. Emily, are you here? Okay, great. Do you want to ask your question? Okay. Do you have a mic? Is there a mic here? Okay. Look at that.
Well, my question for you is what...
Do you want to say who you are, Emily?
Oh, yes,
yeah,
of course.
Yeah.
Hello, my name is Emily Cowie. I'm a business administrative associate here with the Office of Population Health Sciences. My question for you is what has been your proudest moment as a researcher?
My proudest moment as a researcher. So, a few years ago, this was back home in Atlanta. We usually have an end-of-year gathering with our community to celebrate their contribution to research, to acknowledge what they have done, and to celebrate them. Unknown to me, and these were just, so I work with really underserved community. They had, on their own, pulled together resources, and this was about 10 years ago, and they created this very simple plaque. And during that event of celebrating them, they told us they wanted to do something for us. And so they came forward and they acknowledged our contribution to their lives, their community. And unknown to me, they presented this plaque to acknowledge all of our work, what we have done, in their community. This was just spontaneous. It was something that I was not expecting. And many of my colleagues were there. So we also invite colleagues from Emory and Morehouse and all the scientists. That day, I almost, I usually don't cry often. It was probably one of the highest honor that I think for people that I have received for people that I work with, community that had nothing to offer, to pull resources together, to say, we do appreciate what you do. You've impacted our lives. You've impacted our community. we want to give this to you as a token of our appreciation. And it meant I was getting through, what I had set out to do, to use my skill, my profession, my training, my expertise to be a force for good. I kind of felt that sense of accomplishment at that moment. That is one of several moments, but that is the one that that was like such a strong moment in my career.
We have another audience question. Is Denise Kent here? Assistant Professor, College of Nursing?
I'm Denise Kent, and we've had the pleasure now of meeting today, and I'm just so inspired by you.
Thank you.
The two qualities I particularly admire in you is your empathy and your optimism. And so that is just so refreshing to hear. And I'm thinking about how I can build that in my research team, in my grants, in my communication, in my grants, and my publications. Okay, but here is the question. You want to direct me to where the question is here? Okay, great. So what strategies have been most effective in engaging underrepresented populations in your research? We talk about how important it is to speak with the people. How do we reach those people?
How do we reach those people? So this was in 2013. I was transitioning from a junior faculty to a senior faculty. And we had applied for a big NIH award to do some of the things that we were doing. It was a very big award, and they were going to award just one of those awards, just one in the country. Humongous award. I still had a K on my name. It was towards the tail end of my K. And then, and we applied, and we were successful. And so the first thing we did was to celebrate this award. And we took our celebration to the community where these activities, the people who are going to be, we don't even have a participant yet. We just took it to the community. So it was almost $20-something million at that time. For me, that was like big money for somebody, junior faculty who's just become an associate professor. So we took it to the community, and so we celebrated. So all of the community-based organization in Atlanta, we invited the city commissioner from the mayor's office. The entire community came together, and so we launched that big career event, within the community. I'm not sure who came up with that idea, but that became like something that was like, wow, it changed, my relationship with the community. And they felt like, this is something that is most important to him, a big career launching award. He's not sitting in Clifton Road at Emory and celebrating with all his, professors and everything. He's here in the downtown Atlanta celebrating with the participants who were going to be part of that award. That made life easy for me. Yeah, I can't claim that it was my idea, but doing that was really kind of an eye-opener. It just broke down the barrier, and the trust just, the people were like, what can we do to help? What can we do to help? We became the fastest enrolling group in the consortium. We had almost like close to 100% retention rate. People were just giving their time. They own the piece of that program because we started with them. And the lesson I learned from that is that begin with the community you want to work with. You know, bring them to the table from the very beginning. Don't go to them only after a problem comes. You know, before the problem, before you even start the first thing, go to the community, invite them, celebrate with them, and then build the program with the input of the community. And the success we've had in Emory is really been driven by that approach. You know, just engaging people from the very onset, not when issues come. And they guided me, you know, they guided me. It guided me from all of the troubles that I could have fallen into. They were just there, and things were just easy. And that was kind of the same approach when later we became part of Recover. And I noticed that Jerry also have the same approach of all of the hub across the country. I think Jerry's community engagement has been probably among the best. We look up to Jerry for that. Yeah, but really the strategy is really be there in the community that you are serving. Yeah, yeah.
So I have a question. They left me the most challenging name to try to pronounce. Is Osayenwin Mozusi here? Oh, did I pronounce your name okay? How do you pronounce your name? Actually, I would love to know.
Hi, my name is Osayenwin Mozusi, but I go by Osayenwin. Yeah. And so I'm an undergraduate student. I'm majoring in biomedical engineering, and I'm going to graduate this May. And so when I saw you were coming, I was really excited because like all my life I've been interested in infectious diseases. So I wanted to get some of your wisdom. And so my question is, what are some ways I can be involved in the infectious disease specialty and a gap year before medical school?
He's looking for a job. You go.
Get on a flight. Congratulations, first and foremost. I'll give your name to Jerry. Yes. No, I'm really excited. When people express their interest and desire to pursue or to work in infectious diseases, I am very, 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 very excited. And Jerry will agree with me. Infectious diseases is the best specialty there is in medicine. Yeah, but there are so many things that you can do. There are a lot of opportunities, you know, that you can explore in order to engage with infectious diseases. You can do that here. The UIC has a very robust infectious diseases clinical and research program, and I think you can engage with the UIC team. Dr. Novak was just here during the previous. Yeah, you're sitting right next to Dr. Yeah, so he definitely can guide you to connect within the institution. The other big place, national place to go to will be the CDC. CDC has a lot of, they do both communicable and non-communicable diseases, but they have a huge portfolio, infectious diseases portfolio, both within HIV, tuberculosis, diarrhea illnesses, where you can engage as a gap year, and they're usually very open. My son is currently in Namibia. He's working with the Peace Corps, but is working with the country Namibia's AIDS, national AIDS program. He's interested in medicine and public health. He graduated from college in May, and so there are a lot of opportunity that you can explore to really pursue your infectious diseases interest.
Yeah, I'll just add that it's really wonderful that there are trainees interested in pursuing careers in medicine and infectious disease, particularly as we're coming out of a pandemic where it was very scary. I think all of us here, and many of us in the audience, we weren't really sure what was going to happen. I'm looking at Terry Vandenhoek. Your emergency department was ground zero. You all built tents outside the emergency department to have a whole triaging system. And I think this was a scary time. But we've come through it. I mean, that's the beauty of, I think, what we can do if we put our heads together, is that we can solve any challenge as long as we work together and with the support of our government officials and all of us together. So I'm really excited to hear that you want to go into infectious disease, and just tap Dr. Novak in front of you. He is the most recent division chief, and I suspect he can offer some ideas, and we're happy to talk to you as well afterwards. So thank you for pointing that out. So we've gone through a series of questions, and I'm pretty confident that some of you have an idea or a thought or a question or something you want to contribute to this discussion. So I'd like to maybe invite members of the audience. If you have an idea, thank you, Dr. Crespo, for raising your hand. Dean Crespo. So if we can bring a mic over to Dean Crespo. He's our dean for the College of Applied Health Sciences and makes UIC what it is. So thank you, Dean. Would you like to ask your question?
Yes, thank you. Thank you for these distinguished lectures. I come really excited, and then I leave with the imposter syndrome on high, because these people are great. But going back to your experience, what are one or two things, you probably mentor many students, what are one or two things you tell those students as they leave, as they depart after receiving some training from you?
I think to be successful in what we do is not easy. I mean, it's not a piece of cake at all. There's a lot of challenges in what we do. It's hard work. And to be successful, you have to have a true north. You have to have a reference. You have to have what drives you. And when I take on a trainee, one of the things I try to do is to help them find that true north. Why is it you're doing what you're doing? You need to answer that question, otherwise, because you're going to need it. They're going to be the ups, and they're going to be the down. And in the downtime, you always gravitate towards your why, the true north. And so that is the biggest thing I try to inculcate. Of course, we teach our trainees the science, all of the methodologies, but we need, for resilience and to have the staying power to get through the difficult times that are going to come, you need to know your purpose, the reason you're doing what you're doing. And that is one of the things. And I've trained a lot of people, and a lot of my trainings they've been extremely successful. They've done above and beyond what I could even imagine doing. But one thing that is just common to all of them, they know why they are doing what they are doing. And they stick with it because they know why they are doing that. You have to have a purpose, a mission, and it has to be something that you believe in, that you have agreed in, and you're ready to go all way, just all the way through. Yeah.
I'll just add that, I think we would all agree that we focus a lot on faculty, focus a lot on trainees, focus a lot on patients. Another component of academic health systems is our staff.
Yeah.
This has been a really difficult time for our staff in the last few months. We just came off of 2 days of what we call professional development days in our program, where we basically took a pause and we spent 2 days investing in each other and learning together. And we do this once on a quarterly basis. Annabelle Clark, sitting in the audience, helps organize those for our program. And This is not something normally any program does, to shut down operations for 2 days, because there's a lot of things that happen if you have to shut things down for 2 days. So we've learned to do that in the last year or so, because we've realized the importance of developing our people, all of us. So I think that's, I guess, my questions, that's the background. Can you say more about how you've been able to keep your staff engaged? And you can talk about it from the clinical mission if you'd like. You can talk about it from the research mission if you'd like. You can talk about any dimension that you want to talk about. How do we make sure that we provide the same supports and the same opportunities for our staff to develop as well?
Yeah. Well, having worked with staff both on the research side, clinical side, even in the medical school education side, one of the major reasons that staff are unhappy and they quit is the environment. If they are not happy, if the environment is not conducive, and the relationship between people are not working very well, even if the pay is great, even if the job is amazing, it's that environment. People need to feel that the workplace is conducive for them. We see them, we acknowledge them, we value them, and we create a situation where everybody can be their best. And one of the things that I strive to do with my team is to work on that environment. And there are many strategies to do that. And I create a lot of touch points for people to, if you're not happy, create opportunity to be able to voice that very quickly so that we can deal with it before it filters into something bigger. So we pay a lot of attention to the environment within us, and I make it possible, empower my team to talk to me, and to also have people to talk to. In case if I'm the problem, they need to be able to address that with somebody else. And so we have invested a lot of energy, and we can talk about strategies on making sure that the climate around workplace, it's the best climate for everybody. Yeah.
Dr. Lin, you want to add to that?
I kind of want to probe a little bit further,
Yes.
because I think, from an institution perspective,
Yeah.
and from your perspective, what do you think needs to change in order for you to be able to realize how you're going to support these people? Whether it's, a structure that needs to change.
Yeah.
An administration that needs to change. However, you want to think about it from an institution perspective.
Yeah.
For you.
Yeah, so it's a very hypothetical question.
Yes.
And everything in the institution doesn't have to change. Yeah. So the question is, how do you identify those things that need to change? And that is really what we try to do. Your team is the most valuable team. When all of these issues were happening, I sent a message to my president. I said, it's true. We may lose money if NIH takes away indirect. We may lose money if NIH tax our endowment. But money is there because you have people. The money that you're going to lose is not as important as the people. And that you should address your concern, your response to this, whatever is going on now, address it in a way that it focuses on the staff, it focuses on your team, and it focuses on your faculty. And that once they know that, it's easier. If my presidents say they don't need me anymore because they can afford me, if I know they understand, if I know that this is coming from a place of concern and empathy, it's easier for me to take than to say that, oh, by the way, they don't even care for me anyway, they're happy to get rid of me. And so what I try to do is to create an environment that helps us to identify those changes that needs to happen. And once you identify those changes, make sure you're quick in making them happen. Yeah.
Great. Oh, now we got some questions going here. So I might start right behind Dr. Barish, if you'd like to give a mic, and then we'll go down that column and then the one on my left. Yep. If you want to just say your name and
Yes.
maybe the name of the organization.
Yes, Gina
Yeah.
Evans, Nephews Case Management. And if funding were no option, if funding wasn't an issue at all, what would be your dream next project? What would you really want to work on? I know, right?
I want to end the AIDS epidemic. Yes. Yeah. Yeah. And so I have given this a thought, not just end the transmission, but also for those who currently are living with AIDS, end all of the biology that leads to all of the complications that they experience. Yeah. Yeah. Mm-hmm.
You're not aiming high enough. I mean, you said there were no resource limitations.
It's eradicated disease.
Eradicated
When was the
disease.
last-
I
when was the
guess,
last
take,
time?
yeah, no more illnesses. Yeah.
Wonderful. Would you like to introduce yourself and then ask your question?
Hi, thank you for being here. This is very insightful and really thought-provoking. I'm Deanne Pillars. I'm the head of neonatology for UIC and also vice head for academics. And a couple of themes that you've brought up, I just want to touch on and then extend. So we care for incredibly complicated patients with all kinds of advanced technology. And the American Medical Association a couple of years ago actually acknowledged that the patient in the NICU is the most complex patient in the hospital.
Yeah.
We're good with that. We're comfortable. That's what we do. That's what we're trained for. What we're not very well equipped for is the social aspects of health. We struggle with that. I know Ronnie has some insight into how things work, the community, other things. But what really, I think, has impacted us has been COVID, not because our patients have had it, but the families have had it. And we deal now with the absent person who's not there to support that mother or baby because they died of COVID. And I think that we witnessed a huge increase in stress among the families and the parents that we work with, and we haven't really seen that go down yet. So even though the pandemic may have ended, there is something else going on that's impacting these families. And NICUs are a pressure cooker to start with, but this is something else, and it's something more. So my question really is there an understanding of how this is just impacting everyone at large? Are there things we should be anticipating? And how can we get better support for these stressed families that are still dealing with the legacy from COVID that may have left them jaundiced about healthcare in general?
First of all, thank you for the question, and thank you for all you do. I agree. NICU, it's complex, very, very complex. And I don't know how neonatologists do it, but I raise my hat for you. Thank you. The pressure of COVID, post-COVID effect, is everywhere. I think the world is never, in schools, I speak to teachers. I have friends who are teachers who tell me that these kids are never the same. Since after COVID, things have been different. In almost every setting, it looks like, the way to describe it is that as a community or as a society, we have a PTSD, societal PTSD from COVID. And I think we are all still trying to wrap our head around what this effect or impact is, how large it is, what is the what is the impact on the different aspect of life, whether in the NICU, at the workplace, in school, in places of worship. So this is something we're still trying to wrap our hand around. And I am hoping that the work that Jerry and I are doing, Recover, would provide some of the data, because there are things that are beginning to come out of the Recover study that speak to exactly to what you're now describing. First of all, let's describe what the problem is. Then next, let's figure out what the impact of those problems is, and then how do we begin to tackle those problems. Yeah.
Yeah, Dr. Pillars, this is a really, it's an amazing question. I think we're all seeing it in multiple ways, among faculty, among trainees, among our staff, everywhere. I mean, there's just a different, we're in a different era.
Yeah.
And I don't think we haven't recovered from this. I don't mean to use the word recover in this, but we haven't gone back. So I think we're having a lot of challenges in every direction. So thank you for that question. I think that one of the things I'm learning from the long COVID work that, actually Dr. Lynn, there's several people here who are part of the Recover program, is that there's an enormous psychosocial impact that's occurred. And it hasn't worked its way through. We haven't been able to get back to a baseline, but it's important to at least identify it, because then that's our first step, is to identify the problem so we can at least be thinking about it. I suspect, Carlos, you're dealing with it in your students, staff. I mean, every administrator feels what you just said at every level. So thank you for that question. So we have about 10 minutes, I think. Okay, good. Ms. Baker is nodding, so I'm good. I didn't make a mistake yet. Okay. I think there's one more. Okay, was there a question on this side? Okay, please. If you would like to say your name, please, and then your question.
Sure. My name is Shawnette Jones, and I am the Illinois State Director of our AIDS Education Training Center based at UIC in the College of Medicine. My question is, with the potential policy changes that we have that's affecting funding, gender ideology, and DEI efforts, how can we ensure that the scientific integrity and equity remain at the forefront of treatment and prevention? As I'm responsible for training all of the clinicians around HIV, so I would love to hear your insights on it. Thank you.
Thank you so much. I mean, that is what, these past 6 weeks, those are the questions that has kept me awake. First of all, there's so many uncertainties. We don't even know exactly where the chips are going to lie yet, what programs are going to be completely cut, what programs that have been cut that are going to be reinstated, what the funding level is going to be. A lot of that are things that we have know nothing about, which is even a bigger problem. We know how to deal with problem if we know what that problem is. But when there's uncertainty, it drives everybody really crazy. But what I would say is that regardless of what the challenges, the decisions that are made, the problem that you and I tackle every day in healthcare, the problem of access to care, the problem of equity, the problem of making sure that everybody who comes to our door receive the best health care that we can provide. All of those problems are not going away. Regardless of what the policies are, those problems, we are the food soldier. They're going to land on our doorsteps. So we're going to be creative, continue to think about ways to serve those, to meet those needs. They are not going away, whether funding is taken away or not taken away. Those problems are not going away. So it's going to be the challenge of Dr. Barish to think of how to make this work in the face of this uncertainty.
I want to add some optimism that I think, Igor, you had provided us in a previous session, which is the work that we're all engaged in here in an academic health center. It's a noble one. It's a hard one, but it's a noble one. It's about improving health which I think all of us would agree is a critical component, and everyone, it's not a partisan concept. People want to be healthy. So I think we just have to keep our, that's our North Star.
Yeah.
And there are going to be some times when you take a step back or 2 steps back, but it's going to be inexorable progression towards that. It's just a matter of recognizing that challenges come, challenges go, but stay with your true north and realize that sometimes you have to step aside and let some issues come around and organize and think clearly, develop support groups for yourself and others, and figure out how to cope. And I think this session today is part of that. I think we are very like-minded, very oriented around the kinds of topics you just brought up. And so I think this is part of our community. So hopefully you're meeting somebody here and it energizes you to think differently. And I think all of us, we need to draw strength from each other. So thank you for that question. So I think we have one last question here. Subitsa, thank you so much. Would you like to introduce yourself and ask your question?
Yeah, for sure. Hi, my name is Subitsa, and I work as part of the data team here at BCC. So one of my questions, just listening to you earlier, and thank you so much for coming in today. One of the questions I think about, given your previous experience working with policy, and a lot of us here are really starting our careers, I think one thing I'm curious about is, what do you think is the most important thing to keep in mind throughout our careers when we're thinking about how we can remodel the healthcare system or push for different policies to change? I think there's so many things revolved around healthcare. Sometimes it can be a little bit overwhelming. So what do you think is the best way to, what do you think is what we should prioritize, and what is the best way to kind of push forward, if that makes sense?
Thank you so much. It does make sense. It's a great question. So one of the things that, as a early stage career person, we have to recognize that what we're doing is a teamwork. The work we're doing, we are all in it together. You're not alone. You are all in it together. But we need you. We need your expertise. We need your perspective. We need what you bring to the table. And one of the things I encourage my young faculty or young staff to do is that find a place of strength. Develop yourself so that you have something to offer to the group. Be prepared to be able to have something to contribute to the effort. We're not going to ask you to do everything. Nobody has the capacity to do everything. But if data is your thing, and when I come to you for data, I want to be able to rely on you. And so make the best data person that you can be. So whatever that passion is, whatever that area you want to be, just make sure that you're the best in it. Don't be too diffuse initially. Develop your skills so that you have something to offer.
I think we're all thinking here about what you just said. Abraham Lincoln, one of his many quotes is, whatever you are, be a good one.
Yes.
And it's something that I think we periodically need to just remember that, develop yourself, do it well, and also do it for good.
Yeah.
That word good one has a few different connotations here, not only in how you do it, but do it for the good of others as well. So I think we might have one more question, is that right? Okay, all right, I'm getting, Eli? Would you like to ask a question? And you might want to just reintroduce yourself, since maybe not everyone knows you. Yeah.
So my name is Elijah Kindred. I'm the Health and Wellness Director at Bright Star Community Outreach. And so one of my mentors told me this one time. He said, he who controls the language controls the conversation. And so right now there is a conversation that's around the words health equity. And so for me, the question is how do we reframe that conversation? Or is it a thing that we need to rebrand, the words health equity itself, but to get to the same end?
Yeah. one thing, so for those of us who work in the space we work in, if you serve underrepresented population, we have to be creative. We learn to adapt. We learn to be creative. We learn to do a lot with very little. And I think that is what is going to happen. We are committed. I don't know of any healthcare executive or leadership who is not committed to providing the best healthcare to everyone that come to their door. So you can call that whatever you want to call it, but we're committed to that cause. And I think most places are committed to that cause. And it's not going away, and I think we're going to figure out a way to do that. Whether you call it health equity or whatever it is, the name, the branding, we're going to figure out a way to move forward. We're going to figure out a way to find the resources. We're going to figure out a way to, within the conference of the law, the policy, to do those things. And it may well be that names, titles may change a little bit, but the goal, the primary objective, where we're going at, is not going to change. Our mission is not going to change. Our commitment to caring for our population is not going to change. And I think that is not a partisan thing. And even with all of the policies that are coming in, I want to believe that those policymakers also agree with this basic philosophy that we want to provide care for the community. Yeah.
Great. Well, thank you so much, Dr. Ofotokun. A round of applause. And also, thank you, Eli, for that perfect last question to kind of orient ourselves. You can see now why Dr. Barish agreed to invite Dr. Ofotokun. We're inspired by your work. We appreciate everything you do, and you're a community builder, and you're someone who's an optimist, and I think we need more of that than ever. So thank you for coming. So,
thank you.
So we have a couple of things that I want to just thank a few other people as well, and then we have a very special token of our appreciation that I will want to see in all the Zoom calls that you have it on your desk. There's a lot of witnesses here that we will ask for that, so you may want to be ready with that. But I think we can all agree it's been an incredible session. We've learned a lot, and I want to thank our staff. Oftentimes, everything happens for a reason, and our staff are the reason. So if you're a staff member in our program here or anywhere else at UIC or anywhere else, please stand up. Let's do a round of applause for staff. Stand up, please. Thank you. Thank you for everything you do. Also want to thank the staff who specifically pulled today together, the Distinguished Scholar series. It's quite an effort. You can imagine all of the people on stage, all of you, to find the date, the right venue, arrange everything. Not a small effort. So I would like to have Daryl, I would like to have the whole team back to come to the front, please. So I want you to get recognized. Markia, Emily, Eileen, please. Can someone take a picture of the A-team, please? Okay, A-team. Okay, there we go. All right.
A-team.
A-team, exactly. Okay. I think some of you know we've had a lot of stuff go on this week, and through it all, Eileen and her team have put this together. So thank you, Eileen. Wonderful job. And then, of course, want to thank you, Dr. Ofotokun. We're going to give you this amazing thing that you're going to display.
Okay, you drop your mic.
Drop my mic. Okay, there we go. Isn't that like a thing? You drop your mic?
At the end. At the end.
It's at the end. Okay, all right.
The mic dropped.
So it is, just be careful, it'll fall out if you don't hold it properly, but
Okay.
Would like to have a picture. Who's taking a picture? There we go. Wonderful. Thank you. And now, we are going to take another.